I have the great honor of introducing this panel. And with great pleasure, I want to introduce to you folks to Rhodes Perry. So Rhodes Perry is an award-winning social entrepreneur, best-selling author, and sought after keynote speaker. Nationally recognized as a LGBTQ thought leader, he has 20 years of leadership experience, having worked at the White House, the Department of Justice, and PFLAG National. Media outlets like Forbes, the Wall Street Journal, and the Associated Press have featured his powerful work as a diversity, equity, and inclusion influencer. Everybody, big round of applause for Rhodes Perry.
Yeah, thank you, Sarah, and great job. You're a wonderful host. So it's really wonderful being here, and this is such a powerful day. If you're just joining us, we're coming off of the heels of a really powerful youth panel, and I saw someone in the chat window saying, you know, these young people are speaking directly to our hearts, and I really feel that. So I think the voices that we just heard from remind us why SupportOUT, and in particular, the leadership of the Office of LGBTQ Affairs, is mission critical for the county. So I'm grateful to be here learning with y'all. And in this session, that's what this is about, is again, just kind of listening to learn, specifically around what it takes to deliver culturally specific services for LGBTQ youth of color. So I wish, you know, we had Freddie Mercury playing in the background, like We Are the Champions, because we have three incredible champions for LGBTQ young people joining the panel today. I'm getting goosebumps because I'm really excited for the conversation we're about to have. So these folks are among about 20 people that we interviewed during the county's LGBTQ culture audit that my company led last year. And the purpose of the audit was really just to take stock of the county's strengths, some of the barriers, and definitely the resource needs that are necessary when it comes to supporting and empowering LGBTQ youth of color in the county. And the audit's core recommendations are really just intended to create a roadmap for SupportOUT and all the work that together we can do in the months and years ahead. So now is the real treat to learn from our panelists. And specifically what we're going to do is take a deeper dive into learning about some of the recommendations that they offered, you know, one-on-one when we were doing some of our interviews last year. So I encourage you all to stick around definitely for the end of today's panel, because we're going to have the opportunity to take a poll question that will allow you to prioritize, you know, your top 3 priorities of some of the 10 recommendations that our panelists and other folks were able to say, you know, if the county just was able to add this program or add this specific service, we can do a better job at serving LGBTQ youth of color. So with that, you all have the ability to add your input as well. And I'm really looking forward to that. So first off, I'd love for Carla to run a quick poll question. I know we did this at the beginning of the day of learning where you all are working. This is kind of a more consolidated list, but we would love just to learn where you are. So if you're a county employee, you know, you're a community organization, a community member, or someone else, you know, if you're outside of Santa Clara County, just let us know, and that'll give us a flavor of some of the things that we might be speaking to on today's session. So as you're doing that, I'd like to briefly introduce you to our Rockstar panel, and then we're just going to get started with some fun questions and really thoughtful answers. So from Santa Clara County, we have Amber Andretti, and Amber uses she, they pronouns and serves as the principal for Sylvandale Middle School. The school's population is largely composed of Latinx and Vietnamese first-generation college-bound students. Amber led their school to be an inclusive place where LGBTQ plus young people feel seen, valued, and supported. And that definitely goes back to what Mary Bell was sharing earlier this morning about SupportOUT's commitment to centering our work around the sense of belonging. So also from the county, we have Dr. Mitch Gevelber, and Mitch uses he, him pronouns and serves as a pediatrician. He has over 20 years of experience in practice, and he's affiliated with multiple hospitals throughout the county, including the Gender Health Center. So we're fortunate that he's joining our panel today, given his extensive expertise in serving transgender and non-binary young people. And joining us all the way from the Big Apple is Ash McGovern. So Ash uses they, them pronouns and serves as the senior policy advisor for LGBTQ plus initiatives for Mayor Bill de Blasio. So they lead up the New York City Unity Project, which is a groundbreaking, multi-year, multi-million-dollar citywide commitment to support and empower LGBTQ young people. So if we were together, I would say, let's all, give a round of applause. So spirit, hands, fingers, all that good stuff. I'd love to kick off the conversation and frame the discussion around what it means to deliver culturally specific services. So this is kind of an all play. So for all the panelists, I'd love for y'all to, in recognizing that you come from different roles, what might be some of the ingredients? So actions, words, et cetera, that assure LGBTQ young people that they will receive affirming and respectful care, even if that's not in place, like the ideal. So I'd love to start with Amber and then go to Mitch and then to Ash, if that works okay for y'all. So Amber, please.
Sure. So last year when we did the survey, I was the principal of a middle school in San Jose, which was Silverdale Middle School. I'm currently an elementary school principal in Morgan Hill, still within the county, but definitely different. I would say that culturally specific services in a school site could be something as small as an LGBTQ section in a library, because I think a lot of people think services have to be like massive pieces that they can't always come up with. But I would say most importantly, it really needs to start with professional development with the adults. Adults have to ensure that we have a safe place for all kids, and that the language we use, how we speak to each other, reports that are written, the folks that we bring together to help them are all folks that are going to be affirming.
Yeah, thank you for that, right? And I think that's an important reminder, these little shifts that sometimes can mean a world of difference, even just to see yourself or stories, your own stories in a library, is a simple step that requires buying some books, right? And creating a section. So thank you for that. And Mitch, what about from your perspective?
Thank you. And I should say, it's great to be with you and with everybody. I think, so I come to working with young people as an adolescent medicine doctor. And so I guess I would say that I would like our programs, our clinics to focus on the youth themselves, that at the center of the family is the person who's coming in to see us. And that in centering on that person, I want them to know that they're welcome, that they're heard, and as much as possible, they're understood. And that we're going to do what we can to get them what they want and what they need. I wrote this down because in our family, we use this expression, I got you. And I think a lot of the youth don't have that. I hope that they all do. And I wish that they can all find that somewhere and from someone, but I'd like them to believe that we got you.
Thank you for that. And it's just that reminder as well. Remember to center the voices of young people. And we were so lucky to hear from Series Research earlier today. That's what they do. And just the value that was added by having focus groups connecting with young people, and the panel that we heard from today really allows us to remember who we're serving, right? And so it's a really good reminder. And I love that mantra, I've got you. So what does it take for young people to feel that? And Ash, you have this perspective from New York City. So, what might be some of the words or actions from that system level that you're working on with the Unity Project?
Yeah, I mean, I think, it's critical that we build systems and policies and programs, as others have said, that center young people, right? Sometimes we go into the process of building and creating without centering young people, without involving them, without compensating them for their involvement, without creating the conditions through which they're able to meaningfully be involved. And to me, whether it's young people or LGBTQ people broadly, or, intersections of many communities, that in the work that we do in New York City, and I know in the work that you all are doing as well, it's critical to not just involve, but center the work around the needs of the communities who are going to be most impacted. And again, create conditions so that they can, whether that's compensation, whether that's, a range of things, just creating those conditions to make it more possible for people to be meaningfully involved in work that impacts their lives directly.
Absolutely. And it's a really important reminder, I think, for the adults who are here. We have to resist that urge to get into the fix it mode of like, oh, we just have to do this thing to fix the whatever feels like it's broken, and take a beat and do exactly what this session is all about. Like, we have to deeply listen, and who best to listen to than young people, and recognize that lived experience is wisdom and expertise that ought to be compensated. So I think those are really good reminders and things that are within reach that may feel available to some folks here today of where to start. So thank you for that, and just kind of opening up the session. So Amber, I'd like to kind of go to where some of the findings that we found and some of the recommendations you offered. One of the key things that presented a consistent challenge across the board was lacking culturally specific LGBTQ plus resources, right? So things like affirming referrals to community-based organizations, peer support groups, healthcare, the list can go on and on, right? So from your perspective, what are some of the unique challenges that arise for educators when lacking these types of affirming resources? And as a principal, how do you work around those challenges? I know we talked a lot about that, and I think that could really benefit the group that's here with us today.
Sure. I would say that some of the things that we hit as educators pretty quickly is that we just don't have the training. And I think that that's a huge piece that we often forget. Many educators went through their credential program, 10, 20, 30 years ago. What has changed since then? So many things, even within the last year or 2 years. So I think, professional development's a huge one, and finding the resources within our community to do so. I would say also just having a list of resources tends to really be difficult to find. It's like, okay, well, who does this or who does that? And okay, I can get, somebody from youth space who's been wonderful and come out and do some PD with my staff, but then who do I contact if a kid needs a binder? Who do I contact if we need to change a locker room policy? So I think that for educators, it's getting us to have common language and not being afraid of asking the follow-up questions with kids, because I think a lot of people feel uncomfortable. But then also, where are all the community resources, and like, how do we find them, and how do we get them on board, and how do we connect kids to them in a safe way? I think somebody said in an earlier one about public transportation, and it's like, yeah, how do we do that? If we can't afford to put you on the bus or tell you how to get there, and there's only the one place that's only open from 2 to 5 o'clock, how are we going to provide that safe place for you? So I think that some of the unique challenges that we hit in education is like professional development. Where are those resources? And then one of the things I think people forget the most is that when we have kids that need some mental health services, we may know, okay, we have this agency that provides that, but that doesn't always mean that the person that's providing it is the safest person for that kid. And so I feel like it's my role to, when kids come out to me pretty often, it's like, okay, and you're telling me you need some mental health services, great. Now let me go find the perfect person for you, or someone who's going to be affirming and understanding, versus saying, okay, well, in the collaboration meeting, like, okay, who has space on your caseload? Let's just throw you over to this person. Like, we have to be diligent as educators and as principals to ensure that when we hand that kid off, that we're handing them to someone who's going to be affirming and inclusive.
Yeah, that's really huge. And I mean, that was consistent, definitely in school systems and across the county, the lack of a list of affirming providers, and what kind of quality control, what kind of checks are placed in there to, like, what does it even mean to be an affirming provider? And, sometimes we're being reactive. So it's trying to make that quick connection, which, may not necessarily be able to serve that young person's best needs. So really important point of, where do we find, these affirming referrals? And then also, kind of the quality control pieces just to kind of think through. So I think that's helpful as consideration, maybe not a solution here, but something to kind of put a pin in for so many folks that are joining this conversation. So thank you for sharing that. Mitch, I wanted to go to something we talked about last year as a part of one of the recommendations that we came up with was just this challenge, a common healthcare challenge for transgender and non-binary youth of color in particular. So again, kind of going back to the lack of healthcare professionals knowledgeable and skilled enough to serve this population. So, in a kind of alternative universe, if you had kind of complete authority to build a better system, what might be the first thing that you would do to better serve transgender and non-binary young people, and in particular, trans and non-binary young people of color?
That's a hard question. And I guess I may not answer it directly. I don't know that I have one wish. I guess I want to acknowledge, like, looking at our participants, there's 153 people on this call. Among them are my colleagues in pediatrics. And reflecting on what I said a year ago, it's actually remarkable how in a year things have actually progressed in good, positive ways. And I think part of that is a group like this getting together. That's hard work. I think that with pediatricians, with doctors in the community, I think that it's actually the 101 training that would be a great start. Giving, like Amber said, a common language, a common approach, a common affirmation. And I think that that is about specifically gender. It's specifically about sexuality. But I think it's actually about, kind of like the youth told us, it's about seeing them for who they are, for who they see themselves as, knowing that they love to snowboard, so that I think that the trans affirming healthcare system starts with seeing people as people. And that experience of acknowledging gender, of acknowledging sexuality, but seeing a person in front of you through training, I think it takes that training. At some point in speaking, I have to use the word cultural humility. I don't see myself as competent. I aspire to competence, but just being really humble about who am I, what do I have to offer, and how can I best meet the needs of the person in front of me. And I think that, like I said, I think my partners here at Valley, the pediatricians, are doing amazing work, and in family practice across, there's just some amazing steps being made by all of us. But which would be just to put us on this equal playing field.
Yeah, thank you for sharing that. And I think, like, we will hear probably consistently for the next couple of, as long as we're together, about the need for ongoing professional development that's really specific to different roles that are on this panel, and certainly amongst the 155 folks in the space here with us. And I really appreciate what you're saying about humanizing those folks that you're serving, in particular for trans and non-binary folks. And so really understanding what we share, which is, hey, we all have a gender, right? And for trans and non-binary folks, there's some unique challenges when it comes to accessing affirming care, and hopefully piquing the curiosity of providers to say, what more can I do, with the power and the influence that I have in my position to learn more and then to model for my colleagues, right? So I think that's a helpful reminder. So I thank you for that. And Ash, I wanted to turn it over to you. So you are leading up New York City's Unity Project, which is, again, it's a multi-million-dollar interagency coordinating effort. And one of the big goals with this, it's huge, is to reduce family rejecting behaviors and homelessness that disproportionately impact LGBTQ youth of color. So as the county's executive team here in Santa Clara County begins dreaming up how to coordinate a similar interagency effort, we'd love to kind of gain some insights from you. So what might be, maybe one or two lessons you've already learned kind of 3 years into the work that you're doing that may help the county as it's just beginning to launch the SupportOUT initiative in Santa Clara.
Yeah, thank you for that. I think, one thing that we've done in the Unity Project and really focused on is both trying to work towards root cause solutions, right? Preventing family rejection, helping families mediate conflict, building competency within the systems that serve young people, and simultaneously acknowledging that not every family will be reached and not every young people will have the family that is willing to be reached, and that rejection still happens, right? We know that in New York City, but also nationally, from the data we have, the number one cause of LGBTQ youth homelessness is family rejection, right? So while simultaneously building programs to connect families, we also are building programs based in the reality of so many young people who have been rejected and need housing, and they need food, and they need support, and they need jobs, and sometimes they need to be connected to school because they become disconnected through family rejection. So that framing is so vital and so important, and both things are 100% necessary. And I can talk just a minute about like some of those model programs. And the way that we have framed it is that this family rejection or family acceptance work is directly an initiative meant to reduce experiences of LGBTQ youth homelessness. That is the goal. Of course, harmony and love and support and connection between families, but grounded in this reality that we're trying to prevent homelessness for LGBTQ young people, which in New York City is 40 to 50% of the youth homeless population, which is modeled nationally, right? Like that's similar in other places too. So we've done it a couple ways. One is by training clinicians to better support that process of family unification and family mediation and family connection. We've done it in a few different ways. We have invested in peer support groups. We know that family members leading family members is probably the most credible messenger. A parent who is struggling, a caregiver who's struggling to support the trans young person in their family is probably most likely to lean on other parents and caregivers who are also struggling, right? Like we all need to feel connected and like we're not alone in order to be our best selves. I know that. I think we all know that even more with the global pandemic these days. So we've done that, right? We've created and partnered with community-based organizations like CAMBA, which is a social service agency in New York City, and recognized that we need those services, not just in English, but in Spanish as well. And so that's one program that we've created, basically a position for a Spanish-speaking parent facilitator and other support services within that framework, just to create the groups and allow for the conversations to happen and the connections to services. So that's one example. And then we've also done, more system-wide training and certification. So our Children's Services Agency, which Rhodes, like hat tip to you for doing all the incredible LGBTQ work you've done in New York City for ACS, but training folks who are more the clinicians who are at that point of families sort of coming apart, right? Training the clinicians to help mediate those conflicts and hopefully bring harmony back if it's possible and if it's safe, and always centering the young person and making sure the young person there's agency there. So those are some of the, like connecting parents, key piece, training clinicians, key piece. And then I'm sure we'll talk about this more broadly, but the power, I noticed how many Santa Clara County employees are on here. The most remarkable power to me working within government systems is the power to contract and the power to even in services that aren't LGBTQ, whether it's homelessness services, whether it's child welfare services, whether it's work programs, they become LGBTQ when the contract goes to an LGBTQ provider, right? And so we have to be creative, particularly in these financial times for New York City, and I know other places, about how we can integrate and bring in LGBTQ service providers into programs and services that are existing broadly, right, as government workers. So that's some of the work that we're doing. And then of course, you know, working in that contracting sense, partnering with LGBTQ affirming homeless providers like the Ali Fournet Center here in New York City, and creating shelter units and permanent housing units and all of the other things that can help folks, young folks, be safe who are not experiencing the sort of family unification that we also are working on.
Yeah.
So multifaceted for sure.
Yeah, I love it though, right? Because it's kind of like you said, going to root cause, and you know, if at all possible, trying to preserve families, you know, and to work around conflict, and also to kind of treat young people who are experiencing houselessness right now. And so I think there's a lot of lessons to learn. And thank you just for sharing a few of those models. I hope that inspires those folks here joining us of like, oh, okay, like there are, you know, some other cities, maybe not the same as Santa Clara County, but you know, there may be some things that can be adapted or tailored to meet specifically what's going on in Santa Clara County. So thank you for that, Ash. I want to go to now talking more about intersectionality with respect to race and talking about sexual orientation and gender identity. And Amber, I want to start with you. When we talked last year, you were enthusiastic about encouraging the creation of mentorship programs that specifically support LGBTQ students of color to overcome that feeling of isolation. So could you share with us more about why you believe these types of programs are necessary, and let us know how they might be structured to get the greatest positive impact for young people?
Yeah, that's definitely something that's exciting to me. So I'll try and stay, you know, in the bounds instead of going off in a million ways. But I would say that for anyone, finding a mentor is very important. And I find that we forget that having someone that has a similar background or may have experienced some of the things that we've experienced may help be a stronger mentor for someone. You know, I use myself and as an example. I'm never going to understand what some of my students go through. But if you ask me about homelessness, I remember that, right? If you ask me about being a multi-ethnic racial person, I know all about that, right? But I may not know everything that someone's going through. And so it's very important in the isolation side of it. We find that lots of kids, especially middle schoolers, who are already going through a million transitions and hormones and things, that they really need somebody that understands at least a part of what they're feeling. And so at the middle school, we had a GSA that we had created, and it was led by a teacher the first year. And then I realized we're missing a huge piece to this. So we had some high schoolers then join in the second year, and they took over. And so we had a social work intern, myself, a teacher, as the adults, right, that have to monitor, you know, our job in education. But we really had the teenagers mentoring younger teenagers, and the amount of inclusiveness, the amount of change that it brought on the campus in a positive way was astronomical. There was just things that kids were not willing to say in their surveys or in their small groups. But once the high schoolers came in and said, yeah, you know, I experienced that too, then they're like, yeah, let's talk about it, Miss Andrade. It's like, great, let's talk about it. Because they felt like they weren't alone. And then being in the same community and having a mentor that's in your own community is also helpful, because they're, just to be frank with you, you know, sometimes in the Seven Trees area, things aren't the safest. And so for kids that are feeling unsafe and then trying to hide who they are, you know, can really hurt. And then, like I mentioned earlier, you know, maybe the safe place is really far for them to get to, or it takes too many bus transitions or whatever. So having somebody in your own neighborhood that can be your mentor is important, but then also finding people in our community, adults that are safe, people that also can then mentor those high schoolers and then mentor those middle schoolers keeps kids and from being isolated and seeing like, oh, wow, I can do anything. I'll never forget the day that we had a panel on campus for we started with a flag raising, and then we invited community members to come in, and I had a panel of kids, and I said, look, this is going to be a safe place. You know, I'm going to hold it. And like, if it becomes unsafe, I promise I will immediately stop it and we'll get it out of there. And they were like, okay. And they were so open with the adults that they had no clue who any of those people were, county folks included, council members. And that time when kids said, wow, I didn't even know, because I left paper on the tables so that people can write notes to the kids. And when they read those notes later, they were like, wow, I didn't know that our council member or our county person, or they understand what I'm going through. And so being able to say like, look, you're not alone. There's lots of people that feel the same way you feel. We just need to connect you so you don't feel that way. So I think that's something that schools can do. And I think it's our responsibility for all young people to help them find mentors, to help them not feel so isolated.
Yeah, thank you for that. It's a good reminder of the power of peer support and what's needed. You know, if the goal is, you know, we want young people in Santa Clara County to feel a strong sense of belonging, that's definitely not going to happen if there isn't that psychological safety and trusting that, you know, I'm going to be vulnerable and share something that's a struggle in school. And how refreshing to be able to share that and have that be met, maybe with students that might be a little bit older, around, hey, I've been there too, and you know, here's how I tried to work around it, right? And those connections can be really powerful. And there's probably a lot of creative ways to do that now virtually that may even make it a little bit easier. So I was really inspired when you shared that. So thanks for just offering a little bit more to everyone who's here with us today. So Mitch, I wanted to go to something that you brought up when we were talking about how essential it is to have translation services available for folks that you work with, and specifically when you're working with Latinx and Vietnamese families. So can you help everyone who's here today better understand some of the existing language barriers that arise when serving LGBTQ young people when it comes to accessing healthcare? And you know, from your perspective in the medical setting, you know, what type of translation services could support your work? Like, what does that actually look like?
Yeah, thanks. So, you know, the notion of barriers is broad, but specifically translation, it's interesting. A year ago, I must have been very concerned about this topic, and I'm guessing it was a challenging situation where perhaps one of my Vietnamese patients came in with a Vietnamese speaking parent or a young person who spoke Vietnamese. I can reflect back on the days that I must have felt that. At the moment, that's not at the front of my thinking, but when we do translation services, that translator is not in the room with us. And so it's really difficult to establish a connection when you're talking about really deeply personal things. When I, as a provider, am trying to establish trust with the young person and with the family, when frequently the family may or may not be supportive or understanding, when the kid may have just come out recently, in some specific ways, when I speak to a translator, I need to say who knows what in terms of gender identity or in terms of pronouns being used. I need to make sure that the translator actually understands the concepts that we're talking about in terms of what is gender, what is sexuality, and what's the difference. And so occasionally, I mean, it's a lot of educating to the translator potentially. And then of course you need, if you can, to bring the parents along very clearly along with the young person who knows exactly why they're in the medical office. Things like pronouns. I really don't know whether the Vietnamese translator is getting pronouns correctly. I don't know. Spanish, I know enough to know that maybe we're getting it better. Body parts, and you know, whether we're using more general terms or specific terms, which is more acceptable to the family, to the kid, to the translator. Those are challenging things. And I am assuming that when I was passionate about that at that moment, I was in a conundrum where it's just difficult. And I should also add that, in terms of intersectionality, in terms of creating connection when you're using translator services, so it takes someone who is a native English speaker who has a number of differences with my patients, and the greatest similarity with my patients are my humanity and my caring. To do that through a translator becomes quite a step, and I'm guessing that's what I was thinking about at that time.
Yeah. You introduced some really important pieces here, which one, to provide culturally affirming services in English is hard enough. There's a lot of nuance, and to access someone who can translate the services that you're providing in a different language, just in terms of the, like, kind of on the base of what you're doing, you have to find a translator, and then to also find a culturally humble translator who can really affirm the young person that you're working with and navigate some of those family dynamics of how out that young person is or is not, and potentially how that could impact the relationship that that young person has with their family. So very complicated. And I thank you for sharing that, because again, maybe it introduces more questions than solutions, though I think that's important as we build out SupportOUT and making sure that it's responsive to the specific needs that have been popping up amongst community leaders like yourself.
And I should add that even as I spoke, I'm listening to myself reflecting my perspective, and it would be fascinating to hear a young person's perspective of what was that like.
Yeah. So a continuation with the series research and doing more focus groups with young people around translation services particularly. So thank you for that. And Ash, I want to go back to kind of the work that you're doing with the Unity Project, going to root causes. And one of the key recommendations that came out of our culture audit last year was aggressively moving families away from rejecting behaviors, right? And we learned about a few programs like Sol Familia, which is designed for Spanish-speaking families to dispel dangerous myths about LGBTQ people, and really just trying to increase awareness and affirmation of young people who are LGBTQ. And I know you mentioned a number of different models in the previous question I had for you. I was hoping if you could maybe share if you have familiarity around like Cambia or some of the other programs in New York that are working with families that may not have English as their first language, if any come to mind that might speak to this topic.
Yeah, I mean, I think, so Canva is probably the best example, I would say, because it is very explicitly a program focused on bringing together Spanish-speaking families and having a Spanish-speaking translator, right? Like not having that intermediate, or sorry, not a translator, just someone who is a Spanish speaker, and not having sort of an intermediary, so not experiencing those challenges that Mitch is talking about, right? And it speaks to the necessity that it seems like everyone's talking about, to be seen as you are by someone who is like you and someone who has been through your experiences. And another program that I didn't mention, just as another potential model, is we also partnered with an organization called the Ackerman Institute, the Gender and Family Project, and they do incredible work. And so if you are interested in family support and rejection and acceptance, please look them up, Gender and Family Project. But we created a clinician training program with them that is very explicitly and specifically within legal confines. I have to like caveat that because I'm a lawyer. Focused on and centering training clinicians of color, LGBTQ clinicians of color, and not because communities of color are more homophobic or transphobic or like for any reason other than if we want to reach young people of color, if we want to reach families of color who are struggling with it, like acceptance, right? You want to create as many conditions as possible to have a clinician who shares their experiences, both in this context and in other life contexts, which we all know, like no one aligns perfectly in their life experiences, but to get as close as we can to at least having some shared social experiences, right? Because, a Black trans kid and their family might not really want to talk to a cis white gay clinician about their experiences. Could be a totally different experience. And that's that's another thing I think we should always be thinking through in these programs and services is not just who are we trying to reach with our programs, but who are we lifting up, what organizations, what individuals, who are we funding, and what will that inevitably mean about who we reach? Because that's a key piece of reaching LGBTQ young people of color, is investing in organizations and people and programs that are run by LGBTQ people of color, right?
100%. I mean, it goes back to representation and, like you said, shared experiences, which then goes to the trust building. And it's a lot
Right.
quicker to build trust when you can see someone like yourself, even if you don't have exactly the same experiences, but it kind of reduces some of the armor that you might have of like, I don't want to be hurt. So I think that that's a really, really good reminder for folks in Santa Clara County, you know, when thinking about SupportOUT and all of its potential of how to structure it. So thank you for that. So another big thing that popped out of our audit was just around supporting trans and non-binary youth of color. And so Amber, going to you, just your experiences as a middle school principal and also an elementary school principal now, you offered some key challenges that trans and non-binary students experience, and particularly students of color. So you had mentioned the California Healthy Kids Survey and the findings that found that if boys are perceived to be less masculine than their peers, they're more likely to be bullied. So what are some ways educators can offer lessons around respect when it comes to appreciating variances in gender expression?
That one is a heavy one. I would say, you know, for educators, like first, it's gonna be uncomfortable, but you've got to ask the questions. And I think, you know, when you look at the Healthy Kids Survey, you have overarching categories, but then when you dig a little deeper, it starts feeling a little ugly. And I think that, you know, going in and just knowing that it's going to feel that way, just know and then move forward. I think for me, that was one piece that was really upsetting for me to read. And so I did some other surveys and pulled some groups and asked kids, you know, to talk about it. I went through and did my own presentations with kids on gender expression and my own gender expression journey, which then led to another conversation about social constructivism and what things that we learn from birth about colors and genders and gender roles, and especially in a Latinx and Vietnamese cultures. And then from then it came out that the majority of this feeling was coming from like outside the classroom. And it was more of like on the soccer field at lunch, or you know, in the hallways, and homophobic language being used. And it became a larger discussion, and it became a discussion with even the staff of like, how do we address this when things come up, and what do these words mean? Because some of it was like in another language and people just didn't know. So it's like, okay, well, what that word, when you hear that word, that's what that means. And then how do we call kids on it, and how do we talk about respect? And it started as a bumpy journey, but you know, I just want to say to educators that always the data doesn't always feel great, and that we just have to take that into account, and we've got to work through it and be able to be, you know, I think the humble word comes back out of like, we just have to be humble and then ask the questions and work on what it is the kids are saying, because they're going to tell you. It's just whether or not you want to hear it, and then what you're going to do about it. So, and then I just want to say, like, don't ask a question if you have no intention of fixing it or working towards it, because they're trusting you. So if they're going to give that to you, go ahead and know that you've got to do something about it. And then for folks in Santa Clara County, I did have Youth Space come out and do a presentation after I had done those other classes, and they had a panel, and the panel was very open and it was very respectful, and it allowed kids to have a very open conversation. And so I highly suggest that.
Thank you for that. And it's a good reminder of just kind of, as you said, sometimes reading the data or hearing things that challenge maybe your own worldviews may make you feel uncomfortable. And again, if we center young people's experiences of not feeling safe, let's try to prioritize safety, because that leads to our goals of creating a greater sense of belonging. So I really appreciate what you shared there. So Mitch, one of the things that came up around supporting trans and non-binary folks when receiving healthcare services was just the lack of professional development, having more pediatricians besides yourself with the expertise of working with trans and non-binary folks. So I'm wondering what might be a recommendation that maybe with a little bit of distance from the last time we talked, that would maybe help fill this gap, or things that you've seen, maybe not in Santa Clara County, but maybe with colleagues elsewhere, that is beefing up, knowledge around how to better serve trans non-binary folks and affirm them when receiving services.
So a lot has changed since we spoke a year ago. So the Gender Health Center has hired a full-time medical director, and we are very successfully serving, I don't know the number, but transgender, gender nonconforming people of all ages. And the door is wide open, people are coming, and the staff is diverse, the staff is thoughtful and caring. And so that place has evolved tremendously in the last year, and is really welcoming and a great resource. Talking about pediatrics in this area, Stanford has a great gender program, and UCSF has a famous gender program. And even within the South Bay area, there are many family docs who are taking care of young people. And I think more so reaching out to, informally, but reaching out to speak with Jules at the Gender Health Centers, to reach to myself, support from Santa Cruz as well. It's relatively an informal network, and I think it's worthy of thinking about how do we create perhaps a more formal network. I think when I spoke to you, and at that time I mentioned a mental health program called the Gender Identity Awareness Network. So it's all mental health people getting together to support each other, to learn, to reflect on their cases, to support each other. And I go to that because I find that really working with these young people, it is mental health, it is their wellness. And wellness is not about a prescription. I wish it were, that would be too easy, but and that support group, the ability to reflect on your work, the ability to listen to others. I think doctors, medical people tend not to have those opportunities as much. And I think that might be a nice direction to go.
Yeah, it's good to hear that there's capacity being built, and that some of your colleagues are being proactive and doing that kind of professional development. And yet there is that opportunity to standardize, and to make sure that those serving young people are prepared, if a young person is trans or non-binary, that they are ready to serve, and really, like you said, just meet the patient and what they need, one patient at a time. So that's good that there's progress being made. So thank you for sharing that. And Asha, this is the last question. We've got about 5 minutes after this question. So maybe Carla, as Ash is responding to the question I'm about to ask, if you could run a poll. It features some of the 10 recommendations that did come out of our conversation. So we're going to kind of do, it's a both and. So if you can do that, and just kind of prioritize your top 3. And Ash, I wanted to ask you, when it comes to serving trans and non-binary young people in New York, are there existing professional development opportunities to meet the specific needs of the population? You had mentioned the Ackerman Institute. If you have some kind of guidance of how do we in Santa Clara County go from, different professionals being proactive to do that continuing education to doing something that's a little more standardized? Are there examples of that are happening in New York City right now?
Yeah, I mean, I think I feel very fortunate to be in New York. There are so many incredible organizations and initiatives doing this work. And I think we're also fortunate because our city government is very large. So it means not just that I exist in the mayor's office as this sort of interagency coordinator, but there are liaisons in almost every city agency, whether it's dealing with housing or employment or social services or child welfare systems. There are liaisons in all of these systems. So I would say that is an incredibly important thing that happens in New York. And because of it, we have been able to internally, like, to do our work and develop focus groups and have community advisor panels for so many years that we now have a lot of standardized policies, procedures, and training. So I don't know what else to say other than please reach out. Like, I feel it's something that we have in preceding me, like a lot of really wonderful models. And we're working internally right now in New York City to make some of those more public and accessible to other jurisdictions across the country, because there's just a lot that people can learn from and share. And it's, in different links or whatever, but wanting to bring it together. So please reach out if you'd like, but also you can look online if you don't feel like talking to me or something. There are a lot of policies that we've developed and created, and many or most of them have been really community centered and informed.
Yeah, thank you for that, Ash. I think that one, it's just very generous to both do this, like coordinate and lead this work in a massive city, and then also trying to share as much as you can with other jurisdictions that are trying to do the work. And, when we did the culture audit, there was a big piece of reaching out to lots of other jurisdictions that have LGBT liaisons or positions like yours. And between Santa Clara County and New York City, that in terms of massive interagency work, those were two, right? That could be found. Maybe there's others that exist now, and I would love if anyone knows, let us know. But really looking to the Unity Project as a potential thought partner. So it's very generous for you to kind of say, pick up the phone and call, because I know you're a very busy person. So, but I think that that's one of the ways to really develop something that's meaningful and really is both responding to immediate needs and is taking that kind of holistic, systems approach of kind of standardizing as much as you can to make sure that this work sticks, long after everyone here on this call is on to greener pastures and maybe retired and not working anymore, right? But we know that this work will take a while to do. So thank you all very much for being here. We are right at the minute. So I see Sarah has popped back on. So I thank you all. I'm giving you applause for everything that you shared, and hopefully for folks that have listened to this session, it was helpful. And it looks like we've got the poll results here, so we can kind of see priorities that are really resonating with 137 attendees right now. So thank you for doing that. I know that will help SupportOUT tremendously. Thank you.
Thank you. And before we go, there was one attendee that was asking if Mitch, you could remind us of the gender support program you mentioned, just to make sure. Is it the Gender Identity Awareness Network? Is that correct?
Yeah, that's what I said. It's Gender Identity Awareness Network, and it's a South Bay group of therapists that get together, and it's run by Maureen Johnston, who I don't know if she's actually here, but I'm guessing someone in the participants knows her. But I assume it can be found on the web, and it's similar to what Diane Ehrensaft does in the North and East Bay for the Mind the Gap group.
Awesome. Thank you, Mitch. And everybody, round of virtual applause. And obviously you want to put that in the chat for Rhodes Perry, Amber, Mitch, and Ash. Thank you so much, folks, for bringing this such an amazing, dynamic panel to come, hearing from education and from New York. Oh my gosh, New York. Thank you so much for making the time. And also from the health and medical field. A wonderfully dynamic panel. Rhodes, thank you so much for bringing this to SupportOUT and today's LGBTQ Summit. So